All right, welcome back to some continuing coverage here on All Day Live on the Fox Local app. We are continuing because happening right now at the state capitol, advocates from a variety of organizations are sharing how the federal Medicaid cuts are now impacting them personally. More than 1 million Minnesotans get health care through Minnesota's Medicaid program. So we've got speakers here, including from the University of Minnesota, the Minnesota Autism Society, hospital representatives, policy directors, etc. So we're going to listen in.
Follow up with one of us after that if you would like a printed copy. This letter urges our state legislators to work constructively and collaboratively in 2026 to improve the integrity of medical assistance, our Minnesota's Medicaid program, otherwise known as MA. Excuse me. We're asking our state legislators to work together to minimize any harm that implementation of any new Medicaid policy changes may bring to enrollees. We especially highlight opportunities for easing administrative burdens, clarifying and defining exemptions in policy where appropriate, and streamlining data processes. Continuity of care should be promoted in all things, with extra emphasis on protecting access for individuals who rely upon Medicaid. We encourage all of you to read a copy of our letter, like I said, here or online. Secondly, we do have an HR 1 implementation timeline designed to highlight Minnesota impacts and some other handouts available with us today that showcase some of the changes we expect to occur to Medicaid this next year. This is Medicaid Coalition intends to be a source of support, technical assistance, and expertise in helping share education and information related to Medicaid, as well as what Minnesotans and legislators can do to further protect it for years to come. Lastly, just want to make a few announcements related to some logistics. We have 5 speakers confirmed today. We all just came up from a legislative briefing, so we'll have the same speakers, except as Laura mentioned, Jillian Nelson won't be joining us today, but we've got Kurt Rutzen who will be reading on her behalf. I'll be introducing each speaker, and we'll take questions at the end. So with that, I'll introduce our first speaker, who I think we have Sarah starting this time. Go ahead, Sarah.
Thank you. Hi, everyone. Thanks for being here. My name is Sarah Linbo, and I'm here today to represent both Gillette Children's. I'm a new employee there, but really I'm here to speak as a mother. I have an amazing daughter named Greta, who is 14 years old, and she has cerebral palsy, and she's been a patient at Gillette for over 13 years. Greta's story begins with a traumatic birth and a month spent at the NICU at Children's Hospital in St. Paul. She had experienced a significant lack of oxygen to her brain. And if you're not familiar with cerebral palsy, this is one of the most common ways it occurs. Cerebral palsy is a lifelong neurological condition that affects movement, muscle tone, and coordination. It does not get worse over time, but we're learning with Greta that as she grows and gets older, the challenges become a little bit bigger and honestly a little bit harder. So her official diagnosis is quadriplegic cerebral palsy, which means all of her limbs are affected. She also has epilepsy, so she has had seizures throughout her life. When Greta was just a few months old, our neurologist recommended that we start seeking care at Gillette because it was one place that she could get all of her needs met. Our very first doctor at Gillette is named Dr. Deshpande, and she has been a true champion for Greta and our entire family. Part of her job is that she's able to see the big picture of what's coming and what we should do, while my husband and I are just getting through day-to-day living and able to focus on Greta and our son. Early on, Dr. Deshpande connected us with physical therapy, occupational therapy, and speech, and Greta still receives those therapies. About twice a year, she goes through a cycle for about 8 to 10 weeks of therapy. As Greta has grown, so has her team. It's quite a list now that I look at it on paper. She sees neurology, seating and orthotic specialists, urology, nutrition, psychology, and a sleep specialist. Part of her treatment includes getting Botox injections that helps with her muscle tone. And she also has a deep brain stimulator, which helps her control her involuntary movements. She relies on customized equipment to keep her safe and comfortable and just to engage in life. One thing we really value at Gillette is that they view her diagnosis as a roadmap or a plan to take care of her, but they never look at it as who she is. They really see Greta. My husband and Leif and I were introduced to Medicaid just a few days after Greta was born. At the time, we carried private insurance like we do now, but Greta's needs would exceed what private insurance would cover. And the social workers at the clinic knew that and got us help right away to get access to Medicaid to use a TEFRA and through TEFRA and use a waiver that would give her access to equipment and services that we can't have access to with just private insurance. I'll speak to some of those examples. Medicaid funds the paraprofessionals that make it possible for Greta to safely be a ninth grader in high school. She absolutely loves school, and she rates it a 10 out of 10 every day that I ask her. It's a really big positive part of her life, and she depends on those paraprofessionals to make that a possibility. Medicaid also funds personal care attendants, which we call PCAs. And these are people that come into our house and help her with her daily living cares. They take her on field trips in the community, and they help me balance being a mom, not just a caretaker. We have an awesome son, and sometimes that balance is a little emotional and a little stressful. So that really relieves that in our family. Medicaid also provides Greta with an AAC device. We call it a talker, and what it is, it's a computer that's activated by her eyes so she can say what she's thinking. I got a little emotional at this part upstairs with the legislators, so I'm doing my best here. But private insurance does not deem communication medically necessary. So without her device, Greta would never be able to say, "I love you," or tell me what she's thinking or feeling. Without that device, Greta simply would not have her voice. Even with private insurance, we have learned that Medicaid is absolutely essential to the life we want for our daughter and the life that she deserves. And that's ultimately why I'm here today. Medicaid, or medical assistance in Minnesota, is not an option for the people you're going to hear from today or for my daughter. It's absolutely essential. And the changes that are coming at both federal and state level are going to affect these lives and these families. Medicaid funding is interconnected, and when cuts are made to one area, it potentially affects all of them. So even though Greta isn't directly impacted by the new Medicaid work requirements, she will most certainly be impacted by any related cuts to the state Medicaid budget. As you can imagine, yesterday's announcement about further cuts to Medicaid has left us with a lot of uncertainty and anxiety about her future. So we're all here to ask policymakers to look truly at how Medicaid will look in the future with the lens of the people and the families that it will affect. We did not plan this life for our daughter. We did not plan to rely on Medicaid. But like all parents, we just love our child and our children. And we depend on systems that allow them to live and learn and participate in community and their lives. And Medicaid is that system for us and many others. Our family counts on it to provide in order to give Greta the opportunities we've dreamed of for her and the fundamental rights that she deserves. Thanks for listening to our story, and that's how Medicaid really impacts our lives.
Thank you, Sarah, for sharing your story. Next up, we'll have Jen from the Minnesota Autism Center.
Thank you. Hello, my name is Jen Diederich, and I'm the Chief Compliance Officer of MAC Midwest, formerly known as the Minnesota Autism Center. We're a nonprofit that has 18 locations throughout Minnesota, both in Metro and Greater Minnesota. For 30 years, we've provided a full continuum of mental health services and in-home and center-based EIDBI autism services. The autism provider community understands the importance of Medicaid integrity. We've supported and even led the charge with amazing legislators to get BCBAs licensed, which just went into effect last year. Provisional licensure for agencies will start this year, with permanent licensure starting the next year. Responsible, trusted providers have invested heavily in compliance infrastructure, internal auditing systems, and new supervision ratios. This leads to a comment that I have to address from the committee hearing in the House on February 23rd, and the false narrative that it has caused and that we've seen oftentimes in news and on the internet. And that comment was that only 6 of approximately 500 unlicensed autism treatment centers in Minnesota have applied for the new mandatory state license, and alluded that's because perhaps they're fraudulent. Let me shed some clarity on that from our own example. MAC is a nonprofit, and we have been for 30 years. We operate on razor-thin margins. At the end of December, prepayment review went into effect, and we were not paid the amount owed to us for 2 revenue cycles. So we are now behind a significant amount of money. We've done everything we can to not discharge any clients, which is about 300 in our centers, 300 assessment only, so about 600, or to lay off any staff, which is about 550 staff. We've worked diligently to secure a line of credit and cut all non-essential expenses. So working in that financial reality, we were told we needed to revalidate all locations, which for us is 18 centers. This is hundreds of pages of documentations, and it's a $700 per center revalidation fee. As mentioned, we need to apply for provisional licensing also before May 31st, which is about $1,200 per location, which means that between February and May 31st deadline, we'll have to pay almost $35,000 in fees alone, in a time when we're already under such financial strain due to prepayment. At MAC, we've had to weigh these costs with the continued sustainability of making payroll for our staff. We finished revalidation yesterday, and we will take the next 3 months to systematically add our 18 centers, not because we're fraudulent, but so that we can spread the cost of the $35,000 in fees across revenue cycles. EIDBI is not an enrichment program. It's not a daycare. It is not PCA services. It's a prior authorized, medically necessary service treated by evidence-based, scientifically proven intervention under the supervision of a licensed professional. The majority of the kids we serve have nowhere else to go. They cannot go to school. In fact, they've been referred to us from the schools. And parents' last option would be to drop them in emergency rooms, which we know are woefully understaffed and overburdened already. Minnesota's children with autism deserve access to their medically necessary treatment delivered by accountable providers under clear and enforceable standards. I think we can all agree to that. We ask that we continue to stay focused on making this about people and not politics. Thank you.
Thank you, Jen. So next up, we have Tom Smart, who is with the Minnesota Brain Injury Alliance. Welcome, Tom.
Thank you. Good afternoon. My name is Tom Smart. I'm a 61-year-old resident of the city of West St. Paul. 10 years ago, I survived a sudden cardiac arrest. Drivers found me lying on a Winona County road next to my bike and provided CPR until a paramedic arrived. I was stabilized at the same community hospital where I worked as a nurse anesthetist, then transferred out of town to a regional center where a clot was removed from my coronary artery. For the next couple of days, it was unclear whether I would awaken, but I was back home in a week and ready to begin rehab as an outpatient. My heart function recovered quickly, but the lack of oxygen during the cardiac arrest caused persistent cognitive impairment, which disqualified me from returning to work. My brain doctor declared full and permanent disability based on months of cognitive testing. It's a conclusion that the government rejects. I don't need disability services, but without an employer, I do need to find health insurance. And for that, I turned to MNsure, which offers medical assistance based on my income. In January, I'll need to disenroll from medical assistance because I don't meet the new federal Medicaid work requirements. It's unclear whether I'll qualify for an alternative plan. So those are the facts of my story, but let me just give a short editorial. 10 years ago, people in my community thought I deserved a second chance at life. Last year, strangers in Washington decided that I don't deserve a second chance at health care. To my community, I was a real person with an obvious need right before their eyes. Maybe Washington sees me as an abstraction, so I'm standing here today to remove that abstraction from Minnesota state lawmakers. The details of my own story might be unique, but Medicaid cuts a wide path. Across our state, there are real people facing real threats to health who need access to care. Let's find a way to provide all Minnesotans access to the doctors and the health systems that make our state so proud. Thank you.
So for our fourth speaker, we'll hear from Rochelle Schultz, who is President and CEO of Winona Health.
Thank you. My name is Rochelle Schultz. I'm the President and CEO of Winona Health, and I have been working in rural health care for more than 35 years. And I've spent my whole career really understanding what are the challenges and the difficulties of rural health care. And I know what it means when hospitals close or when services are discontinued and people have to travel 40, 50, 60 miles for care. And I'm here because to talk about just H.R. 1 and what that bill does with Medicaid and is a direct threat to our communities and our people across the state. I wanted to specifically talk a little bit more about rural and some of the elements of that bill. Work requirements, as an example, is going to add more paperwork, more administrative burden, more difficulties, and actually result in more people being off of a service that they're actually eligible for. And then we also have the additional 6-month, the change to 6-month renewals. We are at annual renewals right now. We've increased that burden in an already difficult system for people to navigate to twice a year. The system in Minnesota, the Maxis eligibility system, is 36 years old. And this system, there's only 10 states across the United States where eligibility is determined at the county level. In Winona County, we have one person for our entire county to do Medicaid eligibility, which is another burden on the county, but it also slows up the process for people accessing services. When we look at Medicaid in rural areas, Medicaid enrollment is disproportionately high or higher in those rural areas. And the patients that we serve are low-income mothers, their children, grandparents in nursing homes, veterans, and people who are working folks but just don't have access to health insurance. And when they lose their coverage, that doesn't mean they don't need care. It just means they're going to probably show up in our emergency room and likely in a sicker state. And I want to be clear today that it isn't just one hospital, one large hospital in Minneapolis that is having difficulty. We have hospitals across all of Minnesota that are in serious peril right now. This is a statewide crisis that is further accelerated by the H.R. 1 bill, and rural hospital closures aren't hypothetical. We are seeing closures of services, closures of facilities such as nursing homes, and other needed services across our communities. To make it a little bit more specific to my community of Winona, 20% of our revenue comes from the Medicaid program across all of the services that we provide. In Winona County, we have about 8,000 people who are enrolled in the Medicaid program, and nearly half of those are children. The remaining people are the parents of those children, whether they're single or married, low-income working families, elders, veterans, and folks with disabilities. 80% of the babies that have been born this fiscal year in my facility are born to moms who are on Medicaid. And over 70% of the residents in our nursing home are on Medicaid. My organization has worked hard with the state since 2015 on the Medicaid program to ensure that we are providing great services, that we are managing the cost of care and improving the health status of patients. And we've continued to look for ways to align care delivery and financing that makes sense and is responsible. The healthcare ecosystem is deeply connected and intertwined, and changes to payment policies, funding programs, or regulations are rarely done in isolation. Whether it's a loss of services, a loss of coverage, or the ultimate loss of a hospital, the magnitude of change that's coming under H.R. 1 puts my hospital, all rural hospitals, and effectively all Minnesota hospitals in a precarious position. Minnesota has been a leader in healthcare for a very long time, and we are now in uncharted waters. Thank you.
Thank you, Rochelle. I think you took my talking points. Next up, we have, it was supposed to be, like I said, Jillian Nelson, Public Policy Director at the Autism Society of Minnesota, but our friend Kurt Rutson will be speaking on her behalf today because she's out sick.
Thank you, Tina. Thank you for coming today. I wanted to share a few thoughts from our colleague, Julia Nelson, who wanted to be here, but like Tina said, unfortunately, she is out sick. We wish her a speedy recovery. Julianne is the policy director at the Autism Society of Minnesota. She is also autistic, multiply disabled, and she is a Medicaid recipient, especially medical assistance for employed people with disabilities, MAEPD. Medicaid does more than provide health care. It creates opportunity. Programs like MAEPD open doors for working adults with disabilities to pursue meaningful employment across any sector. These aren't token jobs. They are real career match to people's strengths, supported where needed, and designed to individuals can grow, contribute, and thrive. When people with autism and other disabilities have access to Medicaid, employment supports, three powerful things happen. First, community engagement increases. Work is more than a paycheck. It is a daily interaction, purpose, and belonging. Employees build relationships with coworkers, and neighbors become visible and valid members of their communities and bring diverse perspectives to their everyday lives. Second, service dependency decreases with employment supports that are flexible and person-centered. Individuals can move towards greater independence. That means fewer emergency services, less reliance on high-cost institutional care, and more predictable, stable lives. Supports funded through Medicaid job coaching, transportation assistance, technology, and career developments are investments that reduce long-term public costs while improving quality of life. Third, employment turns people into contributing taxpayers. When individuals work, they earn wages, pay taxes, and participate in the economy. That contribution is both financial and social. Employers benefit from loyal, skilled employees. Communities benefit from increased economic activities. State systems benefit from lower dependency and higher long-term productivity. We must be clear, these outcomes don't happen by chance. They require policies that fund person-directed supports, allow employment in any sector without arbitrary limits, and recognize that ability with the right supports is widely distributed. To Julianne and the Autism Society of Minnesota, we see every day transformative employment is. We know the potential that is unlocked when people are given access to real jobs, tailored supports, and the expectation that they belong in every workplace around. Today, Julianne asks you to support Medicaid programs that expand employment opportunities, programs that enable people to work where they want, engage with their communities, become less reliant on costly services, and contribute as taxpayers. Investing in these supports is not only the right thing to do, people. It's the smart policy that strengthens families, workplaces, and our entire state. Lastly, I want to add, this isn't Julian, this is Kurt Rutzen talking. If we don't care about these services, let's say we don't care, tell me. Come and tell me. I could give a rip about them. Tell us you don't care. But I know we care. We care immensely. Let's do all we can to turn this around. We need to. Thank you so much.
Thank you, Kurt, and thank you to all of our speakers. We have a few minutes left on the clock, and I heard that we can stay over a couple minutes if we need to. So I'd just like to open it up to questions from the press. We do have a really solid expertise up here, hospital associations, providers, disability advocates. So just let us know what questions you may have.
Sarah mentioned that $260 million being withheld by the federal government that was announced yesterday. Can you all talk about how that will affect providing these services and people who do receive these services and what that looks like in terms of all of the money that has been kind of moved around recently?
Josh, do you mind if I put this one on you? Or Matt, Matt, come on up. You guys can tag team it.
Good afternoon. My name is Matt Anderson. At this point, this early in the process, we don't really know. There's no real answer to that question. One is the withholding of the funds. We don't know if the state will meet whatever conditions the federal government is placing on that withhold, and eventually get paid, or when. And so all of that is really difficult to be able to say. How does that trickle down into whatever? On a rough estimate, it amounts to about 8% of what the federal government would normally match in state spending. So the state has already paid for the services, has already incurred the costs. Now it's a question of drawing down the federal matching funds that are supposed to come with that. And, roughly 8% of that is being withheld. That's no small amount, especially for a state that's already facing, at least in the next biennium, significant budget challenges. And so how the state responds, where that money, if it ends up coming in, or how it absorbs that funding is yet to be determined by policymakers.
When you say 8%, over what period of time? Is that annual?
This is a quarterly payment. So this is, but in the announcement, CMS indicated that they will continue this through the year. So about $1 billion over the course of a year, if that comes to play. And so this is back of the napkin math. Don't whatever. But that roughly equates to about 8% of the federal funding for our state Medicaid program.
And sorry, just as you're new to the handy sheet that was given to us,
Yeah.
would you mind just saying your title?
So my name is Matt Anderson. I work at the University of Minnesota. I teach in the Health Policy and Management Division at the University of Minnesota. I'm not here in my capacity as a university employee or representing the university. I'm just here as an individual. Thank you.
Question perhaps for some of the providers up there off the back of this issue. If I'm someone whose paycheck relies on this Medicaid system or I rely on it for my healthcare needs, what should I understand right now about what's been announced by the federal government yesterday?
All right, I will kick this one over to you. Josh Berg. I work for a nonprofit based here in Minnesota that provides affordable, accessible housing for individuals with disabilities, brain injury seniors, and then we also provide DHS and MDH licensed services and supports to many of the individuals that live in our settings. I think, as was just stated, we don't know at this moment the short-term impacts. What we do know is DHS is working tremendously hard to come into compliance with whatever those compliance requirements are related to the corrective action plans and the updates that they provided to CMS, as well as, kind of make sure that the system is functioning and flowing well. I mean, I think to the staff that work for my organization and to the individuals that we support, we need to continue to be engaged. We need to be at the table when these decisions are being made, because if this turns into a quarter after quarter type of withholding or deferral, then policymakers are going to have to make different decisions, tough decisions to balance the budget. We know that Minnesota forecast is supposed to come out tomorrow. We'll see how that factors into the forecast that we hear. But every dollar that doesn't come in is going to have to be balanced on the budget, and that may mean cuts to services, cuts to access, individual lives being impacted, and that's the what ifs. And the best thing that I can say for all of us right now, whatever stakeholder group we are in, is be engaged, be vocal, talk about the impacts, and really do exactly what the folks did up here today, is just tell their stories, because it impacts so many people in a variety of different ways that some of the decision makers, both at the federal and state level, may not understand if they don't have a person in their life with a disability or on Medicaid or accessing these supports and services. So I think our voice matters tremendously right now, and it is powerful, and we just need to use it effectively and tell that story. So. Thanks,
Josh. And I'll just, real quick, I'll just add that if if you don't know whether somebody in your life is on Medicaid, I'll just say that you probably know somebody in your life that is on Medicaid. So one of the goals that we're trying to achieve here today is educating and awareness on just how far the expansion of Medicaid, or how far the expanse of Medicaid reaches. Like I said, disability services, hospitals, rural hospitals, metro area. So I just wanted to add that.
Yeah, Rochelle Schultz, CEO at Winona Health. I think, what people need to, understand is Medicaid there's a lot of complexity to it. I mean, there's a whole spectrum of services. And I think that it's a difficult system to navigate if you've ever looked at a Medicaid application and what people have to get together to put in that application. For our part of it as a hospital organization, we're looking at how we can be more proactive with folks to understand when these timelines come up, whether that's around work requirements or the 6-month cadence for renewals and eligibility, and how do we get in front of all of that? How do we help folks navigate all of those kinds of things? At the end of the day, our hospital is open 24/7, 365. And it won't matter whether they have Medicaid or not, or their application is stuck in the process or not. We will take care of them. To that end, though, if this continues in terms of, holdbacks, clawbacks, whatever all of that is, it does, again, put our organizations in sort of a perilous, position because there's no reimbursement for any of that. And we don't want to cut any services. Everything that we provide in our communities is there because that's what our community needs. So I think it's a very challenging time for all of us, and I think at the end of the day, we have to all understand every one of us is a stakeholder in this issue across Minnesota.
Thanks, Rochelle. Any other questions? Otherwise, we can wrap up, but just know that this coalition is here as a resource with, if any questions come up offline or later on, you can reach out to us. And I think Laura would be the contact for that, correct? Okay. Thanks, everybody.